Hey, good afternoon. We're coming live today. We're doing a coaching call with one of the dental students who's looking into trying to figure out how to choose the right residency program. So we're going to be talking with her live today and giving her some tips as to how she should go about strategically trying to figure out which program to look at, which program to select, and to which program to actually apply to also. So we're going to be doing that today and trying to help her out. All right, so let's give her a call.
Hello?
Hey, Doc, how you doing? This is Dr. Hayes. How you doing?
I'm good. Hi, Dr. Hayes. Thanks for calling. I appreciate it.
Hey, no problem. So I got you on. I'm just recording the call so I can give you something that you can maybe use and reference later on too. Okay.
Okay. Yeah, that works. That's cool. I
That helps.
that.
So first, tell me a little bit about yourself and where you are right now and what's going on where you are right now at school.
Okay. Yeah. So, hold on. I'm walking out of the library. 1 second.
Okay.
All right. So, yeah, I'm a fourth-year dental student here at the University of Florida. And I know at this point that I specialize. I definitely want to do general dentistry. I like to do a ton of different things. The thing is, I don't feel ready to do those ton of different things because we just really touched the surface, in these 4 years of dental school.
Mm-hmm.
So I'm just like a little nervous about that because I want to be a spectacular general dentist, who knows how to do all these things. I don't want to have to refer everything out, all the time. So I think that's my biggest concern now is just increasing my skills and all the specialty areas. I don't care where I live or go. I just want to have that experience,
Right. Okay. Where are you from originally?
I'm from Sarasota, Florida, so about 2 hours away from Gainesville, Florida, where I am now. So I've been in Florida my whole life.
Mm-hmm.
And I just feel like, they say we were going to learn a lot this last year dental school, but I feel like I definitely need to do an AETD or a CPR. I don't have a preference. So.
Okay. All right. Well, that kind of gives me a little bit better idea as to what you're thinking and what your current situation is. I've got a list of like 5 things, 5 tips, or at least 5 starting points that I think will help you at least get started if you haven't already started already.
Right.
The first thing is location.
Okay. Yeah.
Location. Think. You want to think first about where you might want to live after training. Some people have a preference. Some people are like, hey, I hate the cold. I don't want to be on the upper East Coast anymore. I want to go to Florida, or I want to be in Texas, or I want to be in California. So they already have an idea as to where they may, just basically where they want to be.
Right.
It may also be a place where you haven't lived before.
Okay. Yeah.
So I would start with, with the actual location.
Okay, location.
Mm-hmm. So you've kind of mentioned already that, you know, you're from Florida, been there. Where'd you go to undergrad?
I've been here for undergrad too, so I've been at US for this is my 8th year, going on my 8th year.
Okay.
It's been a long time.
Yeah. Okay, so undergrad and dental.
Yeah.
Okay. Again, you know, for some people, being in the same location, same state, is okay. Or some people, hey, I'm ready for a change. What's the change? Let's do it.
Yeah.
So
I'm ready for. I'm the type of person I will go wherever I need to go. You know, if it's like the best program, you know, for me, right? You know, so location not a factor for me. If I have to get there and I know that that program's right for me, yeah, please. So.
okay. And then the second thing that I would encourage you to look at is your purpose. Your purpose. For the most part, you know, what are you trying to accomplish and why? What are you trying to accomplish and why? It sounds like from your introduction that you are not necessarily interested right now in specializing. So you pretty much want to be, you know, continue to be a GP, but really, really be what it sounds like to me, a super GP.
Yeah.
Right?
Exactly.
Super GP that has all this advanced training in all the disciplines and is able to treat many different conditions, many different, perform and actually provide many different services and procedures. And that definitely comes with a little bit more advanced training than just yearly CE.
Okay.
All right. So you're looking at a probably it's very possible that you may be looking at least, of course, a first year of residency, but maybe even a second year, maybe even a third year. Or in addition to that, you may be looking at a couple of programs that are fellowship based or like fellowship based, or even another full year of like there's a big implant course that's very, very popular in Georgia. It's the Georgia Maxi Implant course, and it's given by it's given at the university. Well, I think now it's called Regents University. It used to be the dental school at Medical College of Georgia, but they have this fantastic implant seminar that's like 9 or 10 months long that prepares you to place implants, to diagnose. I mean, it goes back to the basics. It goes back to almost like first or second year of dental school with the foundation and knowledge, and then you guys get a chance to place implants, and you guys get a chance to do so many implants that you are able to become certified and become a fellow of the International Congress of Oral Implantologists.
Wow. Okay.
So that's a segue into your purpose, which is becoming a super GP as it relates to at least the implant side of it.
Right. Okay.
Okay. Now, keep in mind, as far as a step before that is a residency program. Keep in mind, just because it's an AEGD or just because it's a GPR does not necessarily mean that they all are created equal.
Okay.
There are one of the main differences between a GPR program or a hospital-based program and an AEGD program is the fact that the GPR program is a little bit more hospital-based, typically.
Okay.
Which means you may have a little bit more medical compromised patients, some complex cases that deal with health issues, a multitude of medications that patients are taking. Some patients, have been admitted to the hospital several times, but just like everyone else, they still have some oral health needs that need to be managed both medically and then also dentally also.
Okay.
So that going to a program or selecting a program like that will give you that experience so that when you have patients in your practice that walk in with the same type of medical conditions, you have a step up on knowing how to manage them in your office.
Okay.
All right. So that's one of the things to consider about the GPR programs, that they're hospital based and that you'll have rotations in what we call family medicine.
Okay.
Well, you'll learn how to do a diagnostic workup or physical exam on a patient, the whole entire systems. You also will have the opportunity to have an anesthesia rotation where you go to with the anesthesia department, and you'll learn and be assisted and assist the anesthesiologist in that aspect of hospital dentistry.
Okay.
I know as a resident many years ago here at Bronx, Lebanon, one of the things that I really enjoyed was that anesthesia rotation, because we got a chance to learn about starting IVs. All right.
Oh, yeah.
We learned all about being in charge of the oral open, making sure that the airway is open and for those OR cases. And we also learned how to do some intubations. Not to say that you're going to be doing that in private practice, but still you just basically get to learn how all the management that goes into making sure you have an open airway and even the whole notion of IV sedation, but it's really general anesthesia also.
Okay.
All right. So those are some pluses about the actual hospital rotation. I'm sorry, the hospital-based GPR programs. As far as the AEGD programs, they are similar, but a little bit different. They are typically more school-based programs. Like I know University of Florida has an AEGD program.
Right.
And those programs, in addition to the GPR programs, you'll have case conferences. There's probably a journal club that you'll be a part of, just similar to what we have here, the GPR program too. And so it's a little bit more, you'll still have patients that have some, medical, significant medical histories, but it's a little bit different as far as there's no rotation in anesthesia. There's no rotation in family medicine. It's more clinical based as it relates to what we are trained to do in dental school.
Okay.
Now, as it relates to being a super GP, which sounds like your purpose, you may find the best of both worlds in a program. I've known maybe a couple of people that have done both, that have done a GPR program or AEGD program or vice versa. Not to say that you should do one, but for whatever reasons, their purpose and what they were trying to accomplish, they wanted both sides of the spectrum.
Okay.
So, like I said, all programs are created equal. For example, there are some GPR programs that are really heavy oral surgery based, and there's some programs that are very heavy implant based.
Right.
But those are just one or two components of everything that's done in dentistry. If you're taking out teeth and you're placing implants, you're not getting a lot of expertise and confidence and experience in endo.
Okay, yeah.
Same thing with pedo or even maybe perio surgeries. You may not be getting a lot of that other things that are more part of the comprehensive care. So that's why defining your purpose is so important, because that'll tend to get you more towards those programs that maybe have more of a comprehensive care type of model.
Okay. Yeah.
All right. So more of a comprehensive care model. And keep in mind too, whatever program you decide to do, a GPR or AGD, and I've had some candidates that are applying to both, so that may be something to consider. By no means is it going to be the end of your training. You're probably going to be, you're going to constantly be training beyond the first and second year of your residency. All right. It's just part of what we do in dentistry as far as lifelong learning.
Okay.
All right. So, but you want to have a great foundation to get started. Dental school is one part of that foundation, but the residency program is another part of that foundation. You'll find that, what it takes you to do on one patient and 2 times a day, you would have already finished 5, 6, 7 patients already.
Okay, so you do recommend doing one of these, not just going into practice or corporate or something like that?
Right.
Okay.
I've got a video on the 9 reasons why a postgraduate dental residency is not optional, meaning you need to do it. And there's 9 different reasons why. And we can talk a little bit about that later also. But one of the reasons is because you don't know what you don't know.
Right, right.
I mean, you have some foundation there at school, but until you get into a situation where you're like, oh, wow, what am I supposed to do? You won't know that until that happens. So residency is a great place to be able to build your confidence, but also build your repertoire of being exposed and having more experiences in certain procedures. Like for example, right now, how many? What's the requirement at your school for endo cases?
Well, we have to have like 1 case per semester. This semester we have to have 2, but that's the only semester where we've been asked to have 2 since we started clinic for 2 years.
So when you graduate, you're supposed to have how many endo cases completed?
I want to say 5 or 6.
Yeah. Okay.
That's required. Yeah.
And are they anteriors and posteriors, or just 5 total?
Yeah, you have to do an anterior premolar. You have to do a molar for competency. So, yeah, all of them.
So, you're going to be graduating in school having done 5 root canal cases.
Right.
So, at any worst case scenario, that's, 15 canals.
Right. Yeah.
So one of the things that a lot of private practice, one of the things that you'll find in private practice is, as an associate, whether it's in corporate or a solo practitioner, they're going to want to know a couple of things. And one of them is, how proficient are you in molar root canals, and how long does it take you?
Okay.
So coming out of dental school with a requirement of 5 or 15 canals, that could be a challenge. That's an area where most students still need some proficiency and some more experience. And you're only going to get that in an environment where you're able to learn without any pressures, without any must-haves on, you got to speed up, Doc. You got to speed up. You got 2 other patients waiting.
Right.
And if you don't have,
I have a question. I have been trying to search through this huge search engine of AEGDs and GPR programs all over the U.S. and there's like so many, and it's like, how do you know exactly what that program does? I've tried to look online at like forums, but honestly, I just wish somebody would just be like, here's 5 that I really like, and here's why. Obviously that's wishful thinking, but because we all have different opinions and things that we're looking for. But I really am having a hard time deciding what program to choose.
Yeah, and I remember that was one of the reasons or how we kind of connected. You saw a post or saw something online that we uploaded, and I think that was it, right?
Yeah, on your Facebook page.
Okay, and then that kind of led to the whole notion of, hey, I'm trying to investigate some programs. I don't know where to start. What do you recommend? So I'm glad we are linking up today to kind of help you go through this. So to answer your question, what it sounds like you're looking for is, a guide, some kind of guide or reference to all these post-grad residents. Because you're right.
Even just like some suggestions.
Right.
Like,
right.
Oh, I've heard about this one and I heard it was great. And then I can look into it because it's just so many.
Right. And that's where the next step comes in, which is your connections. The next step is your connections. You've got a database of recent graduates, whether they be at your school or maybe some other friends that you've come in contact with that are at other dental schools that have graduated, or maybe looking at, like yourself, looking at programs. Part of this process is you've got to tap into those connections and ask people, just like you asked me, where are people going? Why are they going? Why is this program good? Why is this program different? How is it different? But also asking them, and getting them to give you some feedback about those experiences that they had. That's why it's so important to be connected to organized dentistry, even as a student, whether it be ASDA or the NDA or HDA or American Academy of Women Dentists, whatever it is, because that's where you're going to be able to connect with people that are either in your same position or a year or two ago was in your same position, and now they've done a residency or finishing up a residency, and they can give you some insight. So the connections that you already have, you're going to have to tap into them and ask them some questions too, because you're right now there's a big void in the marketplace because there is no guide to, no one's put together a guide to residency programs. And that's one of the things that we are in the process of starting up right now, is putting together a guide of, like, what are the top, there are close to 300 GPR and AEGD programs in the country right now. All right. 300, I think it's like 299. And they are so similar and they are so different. So that's why it's so important that you go back to the first two steps, which is location and purpose, because then that helps you kind of sift through ones that you're going to start to look at. Because otherwise, you can't do a whole list of close to 300 programs. It'll take you forever.
Yeah, the application will be closed by then.
Right. So that's why you have to add that third step, which is your connections. Now, do you have some seniors that have graduated, or people that you know from other schools that are been through the process or going through the process?
Yeah, I've kind of already worked on that step there. I've talked to, I don't know a ton of dentists that have went into AGDs, but the 2 or 3, I guess, that I've called and said, how did you like your year there? Because they're wrapping up their year there. And none of them sounded like what I wanted. So that kind of stopped me in my tracks there in terms of my connections, because, I guess I maybe didn't network as good as I should have my first couple years of dental school, but like a lot of the years that left, I only know like 2 or 3. So that's why I'm kind of reaching out a little farther. For example, you, and just trying to make more connections.
Yeah. Well, you're on the right track. You're on the right track.
Yeah.
2 questions I have with regards to connections. Number 1, if a guide were to come out and be offered, what would be the ideal way to receive it? Would it be like an ebook? Would it be a video series? Would it be, you know, a pamphlet? What's the?
It could be really anything. I mean, you know, it could be honestly a blog with each one, and a resident from the program just talks a little bit about it honestly and openly, or it could be, you know, a book of like short quotes from residents that have been in that program, you know, what they do every day, you know, like a short list of things that they do every day and what they got out of the program, and something they would change about the program, like 3 questions for, you know, from a couple residents in a book or a blog or anything.
Okay.
You know?
Yeah. Okay. And then the second question or comment I have as far as connections, have you ever been to, are you part of SNDA or any of like ASDA or anything like that?
Yeah, I'm an SNDA.
Okay. Every year, now, is your chapter, do you all have a large chapter in Florida?
I think that we do. I mean, you know, I don't know what large is. I think we're in the middle. Like, no, we're in like the middle division. I think I've heard our president say before. So we're not like the largest. We're like somewhere in the middle range.
Okay. So you're like a medium size. How many students?
Yeah.
How many members of SNDA would you say there are at your school?
I would say we probably have like maybe not all be active, but maybe 50, and then like active probably like 25. I think we're like medium.
Okay. Reason why I ask is because that's probably going to be one of your main resources,
right,
as far as connections and finding out more information. Every year, the SNDA has a national convention that's in connection with the NDA, which is the parent company or the parent organization. Right. You've got to go. You've got to go to those meetings, or at least the one that's coming up in July, so that you can network not only with current students, but also other new dentists. I'm on one of the committees, and we are putting together, we're kind of revamping some of the programming for the students and then also for the new dentists. But there is a separate new dentist conference that's in connection with the overall convention, and it's not too far from you this year. It's in Atlanta.
Right.
And it's in July, and you may want to, I can give you a website and stuff to look at. It's actually NDA New Dentist with an S.org. NDA National Dental Association, NDA New Dentist with an S.org. And you can also and you can also go to the SNDA net, SNDA net, net.org, and actually kind of see what they're planning. But again, this goes back to connections. You're going to meet students from all over the country, from Florida, well, of course from Florida, but from Tufts, from Harry, from LSU, from University of Texas, Houston. You'll meet students from Georgia. You'll meet students from University of California, San Francisco. I mean, just all over the place. And they are going to be a source of information for you too, but also, you know, now they're going to be part of your network. In addition to that, we have new dentists or students that have graduated that have been out less than 5 years. And we've created a group within the overall group just for that purpose, to make sure that you all have the resources that you need as you transition from being a student now to being a new dentist that's been practicing, that just graduated within the last 5 years. So that also is going to be very, very key and very helpful for you to get that information from those people too. Okay.
I also have another question. Is applying to like 2 or 3 basically like suicide? Like, I hear a lot of people are like applying to like 10. I mean, I'm probably only going to apply like 2 or 3. Honestly.
Good question. How many dental schools did you apply to?
7.
How many of those 7? How many interviews did you get?
3.
Okay. And of those 3 interviews, how many acceptances did you get?
I got 2.
All right. So you did pretty good. You did 50% on the application. You got an interview, and then of those interviews, you got you're close to 70% on the acceptance, right? So that kind of answers your question with regards to residencies. All right, there are 3 times as many residencies as there are dental schools.
Okay.
Dental schools, there's what, 67 now. It's getting ready to be 68. There's a new school in New York. So if you only apply to 7 of those 66, and you have those statistics, you're probably going to have to, think of it like, maybe doubling it or tripling it for residency. So yeah, applying to only 2 or 3 programs, unless you've got an inside track, unless you have some other connections that are there, you definitely want to, be strategic in the sense of knowing that it's a numbers game. All right, because you can apply to 3 programs, but what if you don't get any interviews?
Right.
Which you didn't.
That would not be good.
Right. Which you, of the 7 that you applied to, you didn't get 4 interviews.
Right. Okay.
So.
All right.
That
answers that question.
Yeah, you definitely want to, make it such that apply to programs that you're either interested in, and that comes up. That leads me to my next thing, which is making a list. Making a list. Once you've kind of made your connections and you've heard about maybe some programs that other people have been applying to, or some people that have been at certain programs, then you want to start making a list as far as location, purpose, and then your connections. You can start to formulate a little bit of a list, and then you can start the next step. The 5th and final step is, doing the research. Actually, all right, I got my list of 20, so to speak, based on where I want to be, based on the purpose or what have you, and based on some recommendations from some other people. Now I've got my list. Now I can start to research, because what you may find, Doc, is from that list of 20, you may only, once you do your research, you may only find 5 programs that you kind of are interested in.
Right.
Because remember, there's close to 300 programs.
Okay.
So these first 4 steps are helping you kind of weed out and make your list a little bit more concise, because there's just so many. Okay. So now you're going to do your research. Now you're going to, so now you got your list of 20, and you're going to go into Google and put those programs in, GPR programs. Or another source for you is going to be through the PASS.
Right.
The postdoctoral application support service. PASS, which is through ADIA, has a whole list of all the programs, and you can locate that through the ADIA website, ADEA, ADIA, American Dental Education Association. They are the leaders in dental education, but they put out a list of all the residency programs, not just GP or general dentistry, but all the other specialties also. But you want to do your search, and there's a couple ways that you can do your search. You can do your search via GPR programs or via AEGD programs. You can also do it by state, and they have it kind of listed both ways. But now you're doing your research and you're going to that list through ADIA and PASS, and you're looking for a website or a listed website that's, or I should say, a working functional website. And from there, you can start to dive a little bit deeper into the programs based on the information that they have listed on the website.
Right.
Now, even that's could be a little bit of a challenge, only because two things: not everyone has a website,
Right.
which they should,
Yeah.
or you still won't get a good overall.
Get like an honest truth. I feel like on those websites, they're gonna tell you.
Yeah. I mean, you won't really get a true feeling for a program just on looking at it online. In order to really get a feel for it and this is what I recommend to students that are looking at programs, especially during this time between third and fourth year, is once you've done your research and you find, say you picked 5 out of that 20, the next step is to really go visit.
Okay.
Go visit the program if you can. I know you're probably.
How important is that for the program, seeing that you came there, visited them, versus you just getting some information about them? Is it important to them as well, or?
Well, I can only speak on what it is for us or for me in our process.
Yeah.
I can tell you, probably more than 80% of the people that have come to visit the program have not only applied, not only got an interview, but also became a resident at the program.
Okay. Cool. And you're in Lebanon. I know there's a bunch of those programs. What one are you, or what one did you do?
So I'm here at Bronx, Lebanon in New York. Okay. All right. There may be a lot of hospitals that have a Lebanon, as part of their name.
Yeah.
But this is my home residency. This is where I did my GPR after dental school.
Okay.
So I
think I know somebody that's there named Marcus.
Who?
I think Marcus Jean.
Yeah, Marcus John. Yes, that's right.
Yeah.
He's here.
High school, college.
You guys went to high school and high school together too?
Yeah, I think middle school even.
Oh my goodness, are you serious? Look, see, there you go. Step number 3. You got a connection right there.
Yeah, I know. He's been great. He's been helping me a lot, getting other connections to other places, and everything. So
I mean, you've got a bona fide resource right there, because not only.
Yeah, I know. I've been trying.
Because he's, as part of his process, he looked at other programs too, if I'm not mistaken.
Right.
So he can tell you, he'll continue to help you with that, that whole notion. But visiting the program I think is key, not only for, I think it's key on both sides. For us, it tells us, you guys are interested, or that you're taking the whole process very, very seriously, because it's not easy to just kind of get up and leave school for a couple of days to travel to go check out a program.
Financial,
it's a challenge, but you know what? People do it, and that tells us that you guys are serious about not only about your continuing education, but also you're serious about the program, because as you see on these steps that we're talking about here, that's like the 6th step. You've gone through the whole process of trying to figure out and doing your due diligence. Now it's okay. Now I'm going to visit the program. So that tells us that, that you are very interested. And then for you as an applicant, you need to go and look at the program so that you can check it out for yourself.
Right.
Because what's on the website, you can't see until you get into the clinic.
Right.
What's on the website.
Now, you as a connection here, and ask how if somebody aspiring to be a superintendent would enjoy your program.
Of course. So a little bit about our program is, it's more of a comprehensive care-based GPR. All right, you will rotate through all the other multidisciplines.
Okay.
But the foundation is comprehensive care.
Okay.
All right.
Okay.
And that's one of the things that I was telling you about there's other GPRs just here in our backyard that are similar in name but different in clinical experience, in the sense that there's one or two of them that have a very, very oral surgery based, which
Right.
means emergency care and extractions.
Right.
Not a lot of fillings, not a lot of bridges, not a lot of endo.
Right.
Okay. And then on the flip side, there are some other programs that are really, really heavy implant based. There's one program where one of the attendings, I'm not sure if he's an oral surgeon or not. I think he is, but I think he's like one of the highest paid attendings, or and I'm not sure if he's the chairman of the department. I don't think he's the chairman of the department, but he's like one of the highest paid attendings in the New York metropolitan area, primarily because the volume of implants that he places on a monthly basis.
Okay.
So that part of that GPR program is very implant heavy or implant based, just because that's kind of like the niche, or that's the area and that direction of where they are at the hospital. That's another thing that you want when you're doing your due diligence. You want to find out a little bit about the mission and the purpose of the hospital, of the program too. For example, us here at Bronx Lebanon, one of the things that makes us a little bit unique is the sense that we are in the poorest congressional district in the U.S.
Okay.
And for a lot of people, for a lot of people, we are the safety net as far as oral health and overall health, meaning the hospital is one of maybe two places, if that they can go to in seeking care for oral health and physical health, overall health. So,
right.
So we're pretty much a hospital of the community.
Oh, yeah, I like that.
Yep. So with that in mind, you're not going to have a lot of fancy cases, so to speak, or cosmetic cases, as far as veneers or maybe a whole lot of implants. Doesn't mean that those types of cases and those types of patients don't want them. It's just that they have to figure out how to, maybe afford and get those types of cases, because the insurance won't cover it.
Right.
But we have residents every year that are placing some implants, restoring the implants, and then also doing, some cosmetic cases as far as veneers or full mouth rehabs,
Yeah.
But also,
Marcus mentioned that you can get like grants or like help them financially and do interesting cases if you want.
Yeah, we're a teaching hospital also. We're a teaching program. Yeah. So, there are some instances where patients can come in and part of the case can be reviewed and approved to be a teaching case.
Right.
So it's a win-win for both the patient. They get the treatment that is needed, or the best treatment that's needed, and then also as far as the teaching and learning aspect, you get that experience as a resident.
Right. Cool. Okay. Yeah, I'll be looking out for that.
Yeah, you need to apply to the program.
Yeah, I think I probably will. I talked to Marcus about it. I'm just trying to, add my other 2, 3, 4 of the list.
Yeah, and if now one thing that's unique about New York is the fact that we probably have in this metropolitan area, New York, New Jersey, and New York is big as far as Manhattan, Bronx, Brooklyn, and then you've got all of the rest of the state, upstate New York, and throughout the state. We probably have about a good 60% of all the GPR programs in the country.
That's awesome. Yeah, a big area.
Big area.
Different from Florida.
Yes, big area. We feed 3 schools: NYU, Columbia, Rutgers, and now there's a new school coming up called Toro College that's coming up. So yeah, I mean it's a place for a lot of people travel actually all over the country to come to train. We've got residents from California, we've got residents from Puerto Rico, we've got residents from Canada. All right, so we've got people
Yeah,
from all
and
over the
yours
place
too, yeah. So,
at our
I
residency.
imagine.
But yeah, visiting the program is a win-win. It's a good look as far as the program's perspective, and having people come. That tells us, you're serious about not only your training, but also, checking us out. And then it's a win for you because it kind of fills the void from talking to people and looking or not being able to find anything on the website.
Right. Okay, yeah. I
So,
mean, yeah, I think you answered most of my questions. I think it's just still up to me to decide which ones I'm interested in.
right.
There's no easy way to really do that. But kind of just go through the steps. So.
Yeah, and just keep in mind, quite honestly, even after a year or two, you're still going to be having to continue to learn. It's lifelong learning.
Right.
All right.
Yeah, I understand. Yeah.
I know down there in Florida, there is there's a program. I think it's through the university. There's a implant program, or there's an AGD program that does a lot of I think it's implants, and I think there's a business side of dentistry that you can get some training in too.
Right. Yeah, I think I know when you're talking about it's very competitive, I'm hearing, but I'll take a look at it.
Yeah, take a look at it. One of the things that's unique about our program, we're probably I know we're the second largest program in the country as far as the number of slots, number of positions. So we have now we've got 32 first-year positions and six second-year positions. Someone like yourself, you may want to look at programs that have a second year.
Okay, yeah, definitely.
That might be helpful too. So I hope that's been beneficial.
Yes, it's been very beneficial. I appreciate the talk, and you'll probably be seeing my name pop up soon somewhere.
Definitely. If you get a chance to come up, just contact me. I'll get you in contact with our residency coordinator, and she can kind of set up an appointment. Again, you just want to go and kind of meet the residents, maybe get a tour of the facility, and get a chance to interact and kind of visualize visualize in person what you're seeing online or what you're hearing with your ears. It just kind of makes it more of a complete thing for you. And then also, if you can put in for some leave from clinic, I don't know if you have a clinic break, but I strongly recommend that you go attend the SNDA convention in Atlanta.
We need to talk to the president about that.
Yeah, I mean, I'm sure somebody from the chapter is going as one of the delegates. I mean, even if you just go for 2 days, if you can't go for the entire 4 days or 3 days, just to go and just meet people from other schools and establish those contacts is very, very important.
Okay. Well, thank you so much, Dr. Hayes. I really appreciate you
taking your
one time.
And how do you pronounce your last name, Violet?
I'm sorry, what was that?
How do you pronounce your last name?
Oh, my last name is Laurie.
Laurie, okay. Laurie.
Yeah.
Awesome. Well, student Dr. Laurie, good luck to you. If I can ever be in a continued assistance, just give me a call, shoot me an email. Hopefully you'll add Bronx, Lebanon to your list. Feel free to come up and visit. Continue to talk to Dr. John. Do you know Dr. El Sherbini?
No, I can't say that I do. No.
She was same as you, Florida. And she was one of our first-year residents and also second-year residents. She was probably, so you're going into your third year right now? No, I'm sorry, your fourth year.
Last Yeah.
Last year. Yeah. We don't want to go backwards. We don't want to go backwards.
No, we don't.
So yeah, she was probably, yeah, she graduated she graduated 2 years ago. So yeah, you I don't think you were there yet. Or you might have been a first year. You might have been first year where she was a senior. So
maybe
cross paths. But you know, if you want to get in contact with her, you want to speak to her about, you know, her experience from Florida and then coming up to here, I can get you, I can get you in contact with her. Just let me know, okay?
Okay, I will. Thank you so
You're
much.
welcome so much, and good luck with everything, and hope to see you soon, either here in New York or maybe at the convention in Atlanta.
Sounds great. All right.
All right, take care.
Good one.
All right, bye-bye. All right. Coaching call done. I think it was good. Good input. So, guys, again, if you have questions about any of the things that we talked about today or any other strategies or tips, again, contact me, newdentistcoach@gmail.com. You can also follow my YouTube videos, subscribe to my YouTube page, Dr. Darwin Speaks. And then also you can find some more of that same information on the website, DrDarwinSpeaks.com. All right. Take care. Have a great day.